So radiotherapy is an integral part of head and neck cancer treatment, along with surgery and with chemotherapy. Radiation therapy is, by its nature, a prolonged treatment because we can only give so much radiation treatment per day, and that's based on good, high-quality data that we have accrued in the past. For this reason, radiation therapy is quite a prolonged treatment. The minimum course is about 4 weeks, and sometimes it goes up to 7 weeks based on the extent of the tumor and the radiation doses required for patients. So the lead up to radiation therapy can be a week to 2 weeks because it takes that amount of time to prepare patients for radiation therapy. For instance, we will have to get a new planning scan done. We have to assess kidney functions. We'll have to get specific molds done to ensure that patients stay in the same place day after day. So all the planning is required for 2 weeks. So while patients are having all these things done, in the background, the medical physicists, the radiation therapists, and a whole team is now preparing the delivery of the radiation to the patient. So they're meticulously mapping out the tumor, deciding which parts of the tumor receive what doses, which parts of the neck that don't show tumor receive a lower dose, and which organs need to be avoided from the radiation field. So a lot of planning is going on in the background. Hence the 2 weeks. That's a lead up to radiation therapy. And once the radiation starts, it's only a short treatment every day, maximum half an hour while you get you on the table, and the mold is placed, radiation therapy is given. For the first 3 weeks, 4 weeks, patients don't usually get much by way of side effects because the side effect profile is cumulative as the radiation dose progresses. You'd have heard the term 2 grays. That's usually the dose given per day, 2 grays per day. And the doses are given Monday to Friday. So once you get into week 4, that's when the skin on the outside of the neck starts getting redder, it gets irritated, the skin peels off. There is a similar side effect on the inside of the throat as well. The lining of the throat gets inflamed, it starts shedding, and we don't quite understand why. Some patients have a higher threshold for radiation side effects compared to others, which means that some patients suffer through it much greater than others do. I don't think we have a clear handle on this, but that's just the way the patient's physiology and the patient's body reacts to the radiation. In addition to all this, saliva gets thicker, they find it quite difficult to swallow. And that's a key indication of patients needing support. They may be in pain control is required. They may need additional nutritional support. Some patients even need a tube placed through the nose into the stomach to help them with the feeding. Others who have even worse swallowing ability and problems before the radiation starts will need a tube into the stomach placed directly through the stomach wall so that they can feed themselves through the radiation. So in summary, there is a lead time, a preparatory time, and then radiation goes for 6 to 7 weeks. But patients don't feel much by way of side effects all the way to week 4, and then the side effects accumulate and they increase for 1 to 2 weeks after radiation is complete, because as I said, the side effects accumulate, and once that is done, patients start recovering from then on. And we normally say recovery takes up to 3 months after the radiation is complete. So it's sadly a prolonged process. We are investigating, we are actively researching ways and means of reducing the radiation duration and therefore the side effects. I could point people to several trials in this particular space, but these are for very particularly meticulously selected patients based on data.